every generation, there's a moment where everything changes. This is one of those moments. Introducing GE Additive.
Hi, I'm Tsung-Yuan Tsai, an associate professor from Shanghai Nice People's Hospital, Shanghai Jiao Tong University.
And can you tell us about what you do at the Shanghai Nine People's Hospital?
So I'm currently a principal scientist working in 3D printing innovative research center.
And the hospital is really different, what's so special about it in Shanghai?
So it's about orthopedics. So we use 3D printing technology to help our patients to solve issues for patients who actually need it the most. For those patients, they don't have any solution in other hospitals, but in our hospital, we can provide them novel solution using 3D printing technology.
And we've just heard you present then at Formnext powered by TCT, and you discussed the 4 levels of medical 3D printing. Could you talk us through that a little bit?
Yeah, sure. So for the first level, with 3D printed medical device can be used outside of human body. And the second level, we print biocompatible medical devices, and but the device is not biodegradable. And the third level is biocompatible and also biodegradable, like tissue engineered stents. And the fourth level, bioprinting for organs, tissues, can be used to replace damaged organs.
And you told us a really, really interesting story then about how the hospital had helped a girl who had never walked before in her life, but with 3D printing was able to walk for the first time. Could you explain that a little bit to us?
Yes, so we got a girl who was 19 years old from Inner Mongolia. She cannot walk at all because multiple knee cancers, which caused a huge deformity for her leg. She cannot walk with her left leg. So with the help of 3D printing technology, we were able to recreate 3D model of her lower limb, and we identified the problem of her limb. We found 60-degree rotational deformity of her knee, and we spent a lot of time to get a good surgical planning, and we execute the plan accurately. And then after surgery, she can walk for the first time in her life. She was so emotional and so happy. And without 3D printing technology, it was not possible at all.
And do you think that 3D printing has become an essential tool in a surgeon's toolbox now?
Of course, yes. Once you try 3D printing technology, you will never do it without 3D printing. So we can 3D print patient's specific model before surgery for surgical planning, and we can print surgical cutting guides during the surgery for precise surgery, and then we can do a patient-specific implant to fulfill the needs of the patient. So ABC, everything can be done with 3D printing in orthopedics.
And is there a particular area of medical now that you're quite excited about in the industry? Is it something like bioprinting or, printing entire organs? Are you really excited about anything like that right now?
Of course. In China now, we have only 1% of patients who on the waiting list can find the matched organ for transplant. So there are still 99% of our patients are waiting. They could die without transplant. So we really need bioprinting to be able to create or duplicate a patient-specific organ to replace the damaged tissues or organs. So we will see.